Hello and welcome to another episode of
Weekly Rounds, and we're talking in English today because our guest is...
Dr. Isaac Bogoch.
So you know him?
Yes, we worked together when I was doing internal medicine training in Toronto.
Okay, good. I remember you sent me one of his tweets. Like he really knows more about the situation than us, of course. And this is why we got him as a guest to be more enlightened about the situation around the world.
Absolutely.
Yeah, so let's hear it from him. So welcome to our podcast. It's like a real privilege to have you on our show. Dr. Ahmed, can you give us a bit of an introduction about our guest?
Yeah, sure. So Dr. Isaac Bogoch is an infectious diseases specialist at the University of Toronto. He did his internal medicine training at University of Toronto and then ID specialty at Harvard. Is that right, Dr.
That's
Bogoch?
Correct. Yeah,
Perfect.
That's right.
Yeah. And so it is our privilege to have him today talk to us a little bit about what's going on with all of the coronavirus, novel coronavirus.
It's been crazy. It's been crazy, Isaac. I think you will agree. Like everybody's freaking out and they actually don't know. Some people are very chill about this. They're not doing anything. Like they just pretend that this is not something serious. It's just like swine flu or whatever it is. Other people are just taking it too seriously, and they're actually isolating themselves from the society. So what's your thoughts on this?
Well, I mean, obviously, I think we need to take it seriously because we know that even though we've only known this virus has existed for 3 months, we certainly know that many people can get infected. We also know that most people that are infected do reasonably well. And actually, most people, probably well over 80%, have a very mild illness. But sadly, we know that the more vulnerable individuals amongst us can have a more severe illness and succumb to this illness, mainly elderly people and people with other medical comorbidities. So, we should take this seriously because it is spreading. And if a significant number of people get this infection, we will see, sadly, we'll see, by and large, the more vulnerable amongst us have more challenging outcomes, and we'll see growing numbers of deaths. And if we can prevent this and mitigate this, then we should do everything we can to do that.
Perfect. So, Isaac, what do you think would be like best strategies to try to prevent this or mitigate this?
It's really interesting because, earlier that answer changes with time. And I think we need to really timestamp all our conversations because, if you were to ask me this, a month ago and earlier on in the epidemic, the goal really was, putting all resources into containing this in China. We should have still, obviously, with that, we always said we had to be prepared for the scenario that this isn't contained in China. But, at the time, it was only in China and, there was a handful of cases in Japan and Thailand and one or two other places. So all the efforts were contain. When that appeared to not be working,
it's not working.
I get it. Definitely not. But when that appeared to not be working, now you're starting to see a strategy towards mitigating negative impacts of this rather than containment. Despite you hearing some senior officials saying all efforts should be on containment, give me a break. This is not contained. There's, over 80 countries that have this infection, and day by day we hear about new countries reporting their first case, and we hear about countries with existing cases having a growing number of cases. Look, this is going to spread broadly through the world. This is spreading broadly through the world, and everyone on the planet needs to be aware of this and prepare. It doesn't mean we panic, but it certainly means we have to be prepared as individuals and be prepared in healthcare systems.
You see, when you say prepare, like it might be, like, for example, in like healthcare organizations, they will take it like containment, right? But for the public to know how to prepare, it's probably their idea is just to stock up on food and just hide in their houses and not go out and just close the schools and like for you, what is the best way to prepare for this?
So I think of it at different levels. Certainly at an individual level, as a, it's daunting, right? Imagine being, well, we all are just individual humans hanging out on planet Earth in the context of an emerging pandemic, right? It can be daunting, and of course there's a fear of the unknown. Of course there is. But you know what? We know a lot about this virus. We don't have all the answers, but we know a lot about it, and that can really arm us with information. So we know how it's transmitted. And, these are things where people can do a couple of things to help out. One, it's extremely important that people are mindful of good hand hygiene. People think, oh, wash your hands in a pandemic. But yeah, of course, that's how you're going to get this infection. This is transmitted by respiratory droplets. The droplets do not travel far at all. They fall to the ground. They can stick to surfaces. We don't know exactly how long this can live on surfaces, but at the end of the day, it's probably analogous to other coronaviruses, and they could probably live for, a couple of hours to a couple of days, depending on the surface and the environment. So wash your hands. And now is the time to really, just like we say in flu season and nobody listens, with the coronavirus, with this COVID-19, people have got to wash their hands and really be mindful of that with soap and water, with alcohol hand sanitizer. The other thing people can do is really be mindful about not touching their face. Again, it sounds silly. It's easy to say. It's really hard to do. Just watch somebody, anybody, and try not to be creepy and have them know that you're watching them. But if you just keep your eyes on someone and watch for like a few minutes, they're going to touch their face a lot. But be mindful. Am I allowed to tell a joke on this?
Of course.
So I'm taking credit for other people's humor. I'm not going to tell you who I heard this from. But one of the strategies is to avoid touching men. And I was, what? Men, your mouth, your eyes, and your nose. Men. But really, avoid touching the mouth, the eyes, and the nose.
But it's so hard. I've been having trouble. I always remind myself, not to do that. And I don't know what to do. It's itchy. What can we do?
And then just a couple of other more points, right? If you're going to cough and sneeze into your arm, not into the air around you. And then, the other thing that comes up is, quote unquote, social distancing. Like, is this the time, if there's a lot of cases regionally, wherever you are on Earth, is this the time to go to that packed nightclub? Is this that time to go?
Well, we don't have nightclubs, but we do have a lot of weddings here.
Okay, so let me finish. You have an international crowd. I know millions of people are listening to your podcast, and I want to be inclusive of everybody. So, what about going to those packed restaurants? What about going to, any place where there's, the big stadium? I think depending on how it is regionally, wherever you are, people should be mindful about this and spacing things out a little bit.
Right. So, Isaac, what do you think of preventing people from certain countries from entering, for example, Kuwait, in our example?
Yeah. I mean, my take on this is that those systems don't work. And I only have a ton of data to back that up, right? In the face of a pandemic, blocking planes and closing borders does not work. You cannot seal yourself off from the rest of the world. And the optics look good. For a government, it says, we're not letting anyone in from fill in the blank of whatever country you want. The optics look good. But does it actually stop anything? It doesn't. What it does is it can slow down the inevitable, and it can delay the introduction or transmission.
Maybe that's what we need, is to slow down things just to buy time.
Well, you already had that opportunity, right? China imposed the biggest travel restrictions and probably the largest public health initiatives ever seen on planet Earth that affected about 10% of the planet. And that bought the world about 2 months to prepare. And, hopefully individuals and healthcare systems and governments use that time wisely to scale up capacity in their hospitals, in their diagnostic labs, in their public health infrastructure to really make sure that they're ready, because China really bought us a good 2 months.
But I mean, the infection, when was the first case of COVID-19? Was it in around October or later than that?
I mean, there's theories about when this truly started, but we only started hearing about reported cases, like a small number of reported cases in Wuhan, China, in mid to late December. But, maybe it was there a little bit earlier, maybe it wasn't. No one really knows.
Yeah, but if that's true, if it started like in December, then that means like we're, maybe there are more cases than we know. Like maybe it's
Well, I think
yeah.
right. I mean, if you start, I disagree to one extent, and I agree on the other. It was in China. It was totally in China, and then China started exporting it. Now, if you look at right now, as of whatever it is, March something, 7th or 8th, it's, if you start looking for cases in many places, you're going to find them. Like in Canada, for example, we just had our first community acquired case. That was inevitable. In the United States, they really dropped the ball on getting their diagnostic testing set up.
Right.
And now that it's scaling up, they're finding tons. So it's look and you will find.
So, Isaac, what do you think of voluntary home quarantine for people coming from certain countries? Is that effective?
So the answer, of course, that horrible answer in medicine that we always give, it depends. So it actually does depend. Like if your country or your region has very few cases, and it truly has very few cases, the home quarantine is a good idea because you will prevent further introduction and transmission in your community that already has a very low amount.
And do you think like home quarantine is for any country? Like, we have a lot of people coming out from, places where there is actually no COVID-19 recorded, and they're still coming here. Do you think everybody who's been on an airplane should be home quarantined or no?
No. I mean, we're in a transition period, and during this transition period, the rules change, and that's okay as long as everyone's aware that the rules can change. And I think as of today, you can still kind of maybe get away with making a list of countries that have more of a burden than others. So, for example, China. We know there's a lot of this in China. Iran. We know there's a lot of this in Iran. We know that. But like Croatia, okay, they've had a case or two. Do they have like a massive outbreak in Croatia? No. But will they in the near future? Maybe. So, if you're going to start doing that, I think it's important to be mindful of what the burden is in many countries. But the problem with that approach, with picking on different countries, as it were, is that when you start to make a list, that list is going to grow and grow and grow until it sort of becomes impractical. And that pendulum is swinging now towards that list growing and growing and growing. So these are value judgments. Like, would you add the United States to that list?
Probably.
Yeah.
Maybe we should.
We had an imported case in Toronto.
From Las Vegas?
Exactly.
Right.
Exactly. So, it's sort of when, we're sort of at a state now where it's like, would you put these countries on a list? Is that list too long? And then in which case, then you start to have to ask yourself, like, those questions about whether or not putting people in quarantine is even useful at this point. So what I'm trying to say is you're seeing a change in public health policy. The rules can be different at different phases during the epidemic, and that's okay.
Right. So you're saying, so if the government decides on a certain policy today and then 2 days later they change it, that doesn't mean that they're they're stumbling or that they're having problems making up their mind. It's just that the situation changes, and as it changes, they have to change the policy.
But if you're a government or a healthcare system, you have to communicate that to the general public, and you have to tell them that the rules are going to change in real time. So and the public has to know, because you need the buy-in and the confidence of the public as well. Right. It's extremely important to have the buy-in of the general public. So the public often sees a government changing the rules along the way. They think these people don't know what they're doing. And you know what? In all fairness, sometimes they don't know what they're doing. And that's a problem. But if they really truly know what they're doing, they will have a plan. The plan will evolve with the evolving epidemic, and they will communicate this in a perfect way to their general public.
And I think in Kuwait, like we're doing that. How about like me and you, Dr. Ahmed, just explain a bit of the situation in Kuwait. I'm sure you're a bit aware like of what's going on in here, but I want to like give you the picture and probably tell us what you think of if this is a good idea or could we do a better job. So in Kuwait, we have like quarantine and isolation. And in the beginning, like a lot of people who arrived from, I think Mashhad, is that right?
Iran, yeah.
From Iran,
specifically
Republic
Iran,
of Iran. They came, and most of the cases in Kuwait is from Iran. And the thing is, when they arrived, like I think there is a growing number, and most of the cases are from there. So they actually put them in quarantine. They put them in a hotel. And it's like they just made it for the Ministry of Health of Kuwait. And then they did another thing where they actually evacuated a whole like what
resort?
Is it called? Resort.
Like a resort, yeah.
It's a resort, and they evacuated that place, and it's also made for a quarantine. And we have another resort, and it's done the same way because we have a lot of airplanes coming from Iran, and we're still like having. I think we stopped from Egypt, right?
So we got around 50 cases in Kuwait. All of them were people who were in Iran.
Cases in Kuwait.
Okay, all right. So
see, he's more, he
okay,
knows
he's more up to date. Yeah. Yes.
Suspending flights to Egypt, Lebanon, Syria, Bangladesh, Philippines, India, Sri Lanka.
Yeah, today. And you see, what's going on also is people are still. Socializing. They're having their weddings. They go to restaurants. They go shopping. And when we see the videos from like Italy, for example, or Germany, where the the shopping malls or the grocery stores are empty. There's nothing there. It's like here, it's always full. Nobody's actually taking precautions or anything. So can you just tell us about what you think of the situation of what's happening in Kuwait and tell us how to make it better?
Well, I can't because I'm not there, and there's always local nuances, local cultures, local traditions, local healthcare infrastructure, and these are policies that are in general principles have to be they are applied locally, and it's extremely important to take the local context into question when policies are being adopted. Having said that, is blocking flights going to stop Kuwait from having a significant number of cases of COVID-19? No, it's not. Is blocking flights and putting people into either home quarantine or self-quarantine measures going to slow down the introduction? Yeah, it probably will. And these policies will slow down but not halt the spread of COVID-19 through Kuwait. And if that's the goal, then that's likely okay. If the goal is we want none of this in the country, I mean, good luck with that. But you're not. It's not going to be no different from anywhere else. I mean, this is coming one way or another, and and it's time to be prepared. Maybe it's just again, I'm speculating here, but if it's to slow down the introduction and spread, great. I hope people are using the time wisely to scale up diagnostic capacity, healthcare capacity, public health capacity, making plans for the more vulnerable populations like seniors. Nursing homes or retirement communities and elderly populations should really have some plan in place to ensure that, for example, this doesn't spread through facilities where there may be a high number of individuals of an older age bracket. So this is the time to really prepare for it. But from a macro policy level, it's certainly not going to stop the introduction, but it'll slow it down.
All right, and Isaac. In terms of what to expect, let's say in the next 6 months to 12 months?
Yeah, good question. So I think we're going to start to see a few things. Number one, forget if you're in Canada or Kuwait or wherever, flights blocked or no flights blocked. we're going to start to see, number one, more and more countries around the world reporting new cases. Number two, the countries outside of China that are reporting cases will be reporting a greater number of cases. And then number three, in terms of Kuwait specific, you will likely still import cases, albeit at a smaller rate if you have flights blocked. But as there's a growing global burden of infection, you will start to import more and more cases that go detected or undetected. And eventually what will happen is you'll start to see community acquired cases. So someone's going to test positive for this infection who never left Kuwait, who never had an obvious contact with someone who is traveling from, Iran or elsewhere in the neighborhood that might have a lot of cases. And there'll be a fair bit of this in Kuwait, as there will be elsewhere in the world.
Right. And in terms of other unintended consequences of COVID-19, so for example, talks about things like air pollution coming down.
In China, for example, that was mostly in China because they really enacted these impressive and vast initiatives where basically they put 70 million people on lockdown and they had, to a lesser extent, travel restrictions and work restrictions to about another 700 million people, really 10% of the world's population. So there were, there's these neat heat maps over China that looked at various pollution levels, and basically they had remarkable cleaning of the air around it because of the country essentially shutting down. But I think the other thing to think about is, we've got to be concerned about a few things. One is obviously the human side of things and the potential for, healthcare systems to be overwhelmed if there's a large burden of infection and people have respiratory compromise. But also, there are tremendous economic consequences to this. Tremendous, people have to people might be working from home. So offices might say, everyone's working from home, or schools might be closed, or people might be calling in sick, or businesses may shut down temporarily due to work absenteeism.
And we're mostly concerned about the schools as well, because there will be a huge delay, and we have it closed for 2 weeks now, right?
Mm-hmm. Yeah.
And it's expected to close until the end of the term. Seriously, everybody's concerned about this, and I think there should be a push into online, letting the students follow their lectures online and do their exams online.
It's being done in many parts of the world. That system is being done in different parts. Actually, some parts of the United States are starting that.
Mm-hmm.
In different parts of Asia are starting that as well. And these are just measures of social distancing that may be effective. It may limit some of the transmission in the community. It's not going to stop transmission in the community, but instead of having COVID-19 rip through a school and then everyone bring it home to their families, it may mitigate that to some extent. And a lot of these boil down to value judgments, right? Is there a right or a wrong answer here? Sometimes there are, but I'm not sure if there is with this, because there are huge consequences either way of closing schools down. Think about if the schools close down, where are the students? What about the students that are young? Who's going to be with them? Where do they go? Does that mean a parent has to stay home from work? How is that managed?
That's a big issue. Yeah.
Right. Yeah.
Of course.
So let's talk about the potential treatments and what is out there right now and what is being studied. Can you give us any ideas?
Sure. So in terms of actual treatment, the current treatment is supportive care. That's fine. Support. We all know that. We know that means fluid and electrolyte balances. It means supplemental oxygenation. It might need, for the sicker people, it might mean intubation and ventilation. We know that steroids do not work. So the thought about using steroids is just a no-go for the critically ill people. It's not going to help with the ARDS. In fact, there's some shreds of evidence that suggest that it might actually make things worse. So no steroids. Then in terms of antiviral drugs, Currently, there's no antiviral drug that we know of that will work against this COVID-19. However, there are probably over 125 clinical trials that have been registered in clinicaltrials.org and basically the Chinese equivalent of it to look at antiviral drugs. I think the two promising ones are an antiviral drug, remdesivir, and another antiviral drug, it's Kaletra is the brand name. That's lopinavir mixed with ritonavir, which was used in HIV. So there's certainly trials for those two that are recruiting patients. And, as always, it takes a while. But I mean, in the context of an epidemic, it might not be that hard to find patients. So, some of the silver linings of an epidemic. But, I can't imagine we'll have results for another 2 or 3 months. I think in many places they're using these drugs for, in critically ill people, I think they're still using these drugs and they're having the frank conversations with families saying, we're not sure if this will work or not. This is under investigation. But in the context of, critical illness, here's a potential option.
So before we wrap up, just like there is something that's been like, I don't know if it's a rumor or there is a study about this, but about like the COVID-19 having proteins from HIV. And it is like a huge discussion because it did reach the public.
We're not into peddling pseudoscience. We are not into peddling misinformation. We are not amplifying bullshit. Pardon me for swearing.
Yeah, this is the thing. It's like it's everywhere. Even the public. Like I've been receiving like 10 text messages today. Just doctor, is there like HIV? Is this going to give us HIV? Like so, this like the questions that's been going on in Kuwait.
This is why the internet was the best and the worst invention in the world, right? Like,
yeah,
crazy. I think one thing that we should talk about for 2 seconds is, like the real solution, long-term solution is vaccination. And, there's a ton of effort being poured into vaccination. That's wonderful preventative care. We're not going to have an effective vaccine for a year, despite what people say. Oh, yeah, we've got a good one. Oh, this is going to, no, it's going to be a year at the minimum. And it might even be longer. But I think all efforts, of course, are to look at how to better treat this, but also how to prevent this. And vaccination is key.
Yeah, so thank you very much, Isaac. This was fantastic.
Anytime, Ahmed. It's wonderful to talk to you again. I miss you.
Thank you.
Come back to Canada and join us.
No. He's here now. Sorry.
Thank you. That's very nice of you to say. So anything else you want to add at the end, Isaac? Or,
no, it's great chatting with you about
thank
this.
You.
I hope you have a good day.
Thanks, you too.
Okay.
Thank you very much, Isaac.
Take care. Bye-bye.
Take care. Go ahead. Bye-bye.
Bye-bye. Okay, so what do you think, Dr. Noor, about what we just heard?
Well, I'm just a bit worried, but I think the best message is not to panic, to follow the instructions given by the Kuwaiti government and the Ministry of Health. So far, we're doing really well. We have bought us some time, and I think we do need to prepare ourselves better in terms of prevention. Like a lot of people have been taking this lightly, and I wish that, they take it more into their hands and, just being more in control of the situation rather than, there's nothing going on around the world. It's like swine flu or whatever. So I think this is what I've learned today. What about you?
Yeah, absolutely. I agree. We need to take this more seriously. Also, the fact that as the situation changes, our policies will have to adapt and change. Some things are just impractical. You can put a few people in home quarantine or like even like an actual physical quarantine, but you can't do this as more and more countries are added to the list. You cannot shut down borders, and that doesn't work either. So
but
that's
I
important.
think, as he said, it is good strategy right now to buy us time, but probably later on when we have more cases, then probably or hopefully we have some hope in treating this COVID-19. And we wish you all, guys, all the best of health. And please stay safe and follow instructions. As we said, keep your hands clean. I think you know the drill, Dr.
Yes.
Ahmed.
Clean
Tell
your
us
hands.
more about the 3 golden rules.
The 3 golden rules. Yes.
Yeah, keeping the COVID-19 away.
Yeah, so you're gonna wash your hands.
Yeah, how many seconds?
20 seconds, which
At
apparently
least.
is singing happy birthday twice for some
Okay.
reason. That's how we're measuring
I
our
think
hand
it's
washing.
more. I think this is 40 seconds.
40 seconds.
Yes,
We have to wash our
singing
hands for
happy
40 seconds
birthday.
now?
No, I mean
Oh.
singing happy birthday twice.
Oh, I don't know.
You want to try that?
Sure.
You want to sing happy birthday?
I don't think people want to listen to
No,
that.
I don't think so.
Okay. So that's rule number 1. What's
Number
rule
1,
number 2?
To keep the surfaces clean, just keep all the surfaces clean. Just try to use a good disinfectant. You can use chlorine diluted in water, like 1 to 9 in concentration. And just teach your kids as well. Just, give them some errands to do and clean up the house. Number 3 now.
So before we do that, can you explain what do you mean by chlorine 1 to 9? Like how would we actually do that?
Just, just use 1, how do you say it?
Like a cup of Clorox combined with
Kind of.
9 cups of
Kind
water?
of. Any chlorine
Okay.
disinfectant.
Got
is, yeah, because
Okay.
I think a lot of brands are out there, so
Right.
I don't think we should mention brands.
Sure.
But all you need to do is dilute 1, unit of chlorine to 9 units of water. And this
Okay.
is the concentration you use to clean up. And as I said, you need just to be, making the kids involved in the cleaning process if you want, and around the house, of course.
Well, they're not at school, so it's a good use of their time.
Especially the iPads and the phones, they're
Right.
just like, I don't know, my kids are like that. They
Yeah.
just like use their iPad and be eating at the
Yeah.
same time. It's like, no, what are you doing?
I know.
But
Their
kids,
iPads are always disgusting and slimy
they're
and yeah.
slimy.
Yeah.
So what is tip number 3 or rule number 3 to
Rule
overcome
number
this?
3, I'm guessing avoid big groups.
I think, he said that as well,
Yeah.
right?
Yeah.
Like just to avoid crowds.
Right.
As much as you can. Don't be going to, socializing will be very difficult. But I mean, come on, everybody's using their phones anyway.
Right. Yeah. So you can use Twitter and
You can.
social media and WhatsApp instead of going, I mean, small groups and, it's okay to see your friends, but the problem is with big gatherings where people are in close contact with each other. I think that's the problem. But, going outside to the store to buy your supplies, I think hopefully is not a big deal. Just don't stay too close to a lot of people, especially if they're coughing.
Yeah, absolutely. So I think let's wrap up.
Sure.
Thank you, everybody, for listening. This was Dr. Noor Al-Nibari.
And Dr. Ahmed Al-Hashemi.
And, this is our first English episode.
Yes.
So if you do want more, please suggest us few names, of people you want us to interview for the next episodes of Weekly Rounds. Goodbye.
Fantastic. Goodbye.
مقدمة لازم أول شيء. Let's start an intro.
Yeah, so we'll start with our introduction.
Okay, 1,
Okay.
2, 3, go.
So أهلا وسهلا وحياكم الله في حلقة جديدة من بودكاست
Weekly Rounds.
معكم دكتور أحمد.
No, wait,
No,
Dr. Ahmed.
yes.
You have to speak in English, okay?
Speak in English, yes, of
Yes.
course, because this whole episode is going to be in English.
Oh no, I'm happy to do my part in English. I just
Yeah.
need to understand the question.
Okay, perfect.